important turns in how healthcare is developing is that care is being delivered by teams. These teams are often taught in silos, so medical students, nursing students, pharmacy students all have different ways of understanding how healthcare rolls out, and as a result are not always taught how to work together. And then in practice environments, as we move to team approaches of delivery of service, then there are disconnects. When there are disconnects, we know from investigating several things that communication and transfers of care, one of the major challenges to patient safety. They threaten safety when one is looking for a particular set of harms while another one is creeping up. Multidisciplinary is a first step where people are acknowledging that there are multiple perspectives in a problem. We want to move that forward. We think that some of those initiatives of multidisciplinary were a good start, and now it's time to bring in the interconnectedness needed for interdisciplinary work. With that comes specific training in how to be a team. People can work together based on their personality or their goodwill, but the training is an essential piece. We know that there are certain things that are not measured about working together in an interprofessional team. We know that provider satisfaction goes up, that retention happens. We know that patients feel like they have a broader sense of resources available to them. There is a need for strong evidence. So the particular measures that are currently used to track healthcare may or may not be actually capturing whether it's effective or not. So at this point, we have growing evidence that working as teams have the outcome measures that will actually see patients exposed to less harm. The way we have framed team intelligence that support providers as well as patients and families have 6 components. And of those 6 components, as they work together, it's the combination of team reflection and function, sense of purpose, all of those things that actually make the team behave in a way that we call smarter team, as opposed to parceled out ways of behaving together. There's a difference between just being a group of well-intentioned individuals and actually being a team. And of those, the communication pieces, the power differentials that get resolved, the cross-monitoring, shared mental model, distributed cognition, and psychological safety. Those are all pieces of a team actually being able to work synergistically and beyond what they could do individually. Where there are gaps in communication, we know that there is a correlation with an increase in medication errors, errors of identity, judgment errors, clinical judgment. Communication is essential. It's not only important to look for ways to communicate effectively, but to ensure that there is not a misunderstanding, which is another skill, rather than just telling something, to have mechanisms, feedback mechanisms, clarifying mechanisms, language that allows an interruption when things aren't understood. That becomes the cultural piece of how language happens, because communication is about meaning and about shared meanings and getting meanings back and forth. So training, not just training in communication, but the mindset of wanting to be understood and heard is really important. The other side of that is silencing, and that silencing can be used in a way that changes the power dynamics. And so that communicates something as well. What is really crucial in ensuring patient safety is that all information is valuable. When there is a threat of infection, how the floors get cleaned become important. where there is scheduling, how time is used becomes very important. So in order for teams to function well, it can't just be the person doing the direct care. It's all of the supports that have the patient in a place where they will be heard and not misunderstood. Nurses sometimes have a difficult time articulating their work. They like to frame it within a caring narrative, and that is not necessarily understood by other members of the healthcare team. And so there's a challenge for nurses to be able to put into words what they do, not just that they care for patients, that they assess patients, that they determine responses to medication, that they interpret lab results and what vital signs and trends in their condition and whatnot. All those things are things that nurses are very good at doing, but have a difficult time articulating to the team how that contributes to patient safety, how it contributes to patient care. I have 3 tips for nurses to improve quality of care. First tip is one on attitude, and that is being a confident nurse, knowing your science, knowing the relational pieces of interacting not just with patients but with other colleagues, to be able to be confident and step forward in areas that will build teams, will build healthcare delivery in a team setting. Nurses are traditionally aware of being patient advocates, and it is an opportunity to move that a little further into how patients can advocate for themselves within a team structure. The second would be skill-based, that nurses identify their skills and be able to articulate their skills and knowledge within a team. The third thing would be competency, which is using skills and knowledge and attitudes in the right place at the right time in the context, and making those clinical judgments that enhance not only the patient experience but safety of patients.